So welcome, we'll get going. I'm Tony O'Sullivan. I'm a member of the Save Lewisham Hospital Campaign. I used to be a consultant community paediatrician working mainly with children with disability in the community in Lewisham, which was great. And I was Director of Children's Services when the Lewisham Hospital came under threat from Jeremy Hunt. Sorry to mention his name in public, but Jeremy Hunt in 2013. We dread to think if we hadn't won that campaign and if Lewisham Hospital were now closed and we were short of over 400 beds, what on earth would have happened in South East London. Today we've got several speakers and we're going to give you a really good flavour of things around COVID, South East London, what's happening in schools, what's happening in the community and what's happening in the hospital. For that reason, several speakers, and we're only giving them a very short time, so apologies to the speakers, but thank you very much. I also am co-chair of Keep Her NHS Public, which is a national campaign for defending the NHS in this country. It's been going since 2005. COVID has been nearly a year now in this country, and we're at a really, really serious point in time. Today we heard that China was responding vigorously to 85 new cases, and the whole of the country was on alert. Today, however, we announced that 83,000 people have now died within 28 days of having COVID, and excess mortality is probably over 100,000. So there's something to be very, very humble about how terrible our country has performed, and we're going to be holding the government to account more and more. This meeting is going to be broadcast live on Facebook, so I hope that's okay with everybody. Those that, if they need to, they can watch it again on Facebook if you've missed it. We're muting everybody during the meeting unless asked to speak. And depending on the size of the meeting, we're going to rely on questions in the chat function, which I'm sure you're all familiar with now after a year of Zoom. But if you click on participants and click on chat, you can see the list of people, and you can also see the chat, or you can see the chat on its own, of course. And we'll be picking up questions to the speakers from there. We may also be able to take verbal questions, in which case we'd ask you to unmute yourself. I'm going to welcome the speakers now in order of them speaking. The first is Dr. Louise Irvine, who's a Lewisham GP, and she's been our campaign chair since 2012, when she had the foresight to set up the campaign even before the final announcements to close the hospital came out as a huge threat in the late autumn of 2012. We've also got a video from Ben Travis, the Chief Executive of Lewisham Greenwich Trust, about which was a message to staff, and that gives some really good context. We've got three frontline NHS staff: Dr. Sonia Adesara, Dr. Lola Fakoya-Sales, and Dr. Aaminah Verity, who are local doctors. The last two are in Lewisham. Duncan Morrison, who's the Secretary of Lewisham National Education Union and a local teacher. Parent Vicky Penner and her daughter Emily, thank you very much and welcome. We were going to have a second parent, Toyin, who's one of our campaign members, but unfortunately she's ill. So if you are watching, Toyin, I hope you get better very soon. Hera Lorandos is also here. She's from Lewisham Refugee and Migrant Network, and we've been working really well with her and others in the campaign against migrant charges. And finally, Susan Michie, who's a professor of health psychology in London, and she's a member of a wonderful organisation, Independent Sage, that has now been holding weekly briefings for the last 7 or 8 months now, since May. and we're very pleased that she is our keynote speaker. We're asking people mainly to speak for 5 minutes or a little bit less, but we've given, or a little bit more in the case of Susan Michie, but we've given you all notice about that, and I hope that's okay. We're going to start off with Louise. I mentioned that she's local GP, chair of the Lewisham Campaign. She's a prominent NHS campaigner, member also of the National Executive of Keep Our NHS Public. She stood twice against Jeremy Hunt in general elections in 2015 and 2017. She's famous recently for a tweet when she recoiled in horror viscerally at seeing Rishi Sunak entering the building where she is a GP for his own photo opportunity. So Louise, if you don't mind launching our campaign, thank you very much for speaking.
Thank you. Thanks, Tony. And good evening, everyone. And it's fantastic to see tonight's turnout. And we've got some very, very interesting speakers tonight. For me, I was just reflecting on the whole COVID issue. And I think for me, there's three real, very strong elements to it. One is that the way COVID has affected me personally. And one is how it's affecting me as a GP. And also how my role as a campaigner, NHS campaigner, and they all intermingle, all those roles. In terms of personal, COVID is very real for me because my father died of COVID in April. My husband was very seriously ill with it and was actually admitted to St. Thomas's Hospital and nearly had to be ventilated, but luckily didn't need that. And my mother, who's 95, was also admitted to hospital and has survived. And both my husband and my mother have done really well. I just say that because sometimes the personal is political, and this is a very good example of that. It's very real for us as health workers, and I know there are many health workers who have suffered and who've been seriously ill, who've been in ICU or who have died, sadly. But also many of my colleagues have really gone beyond the call of duty to actually look after people with COVID. And, you know, it's been very, very hard for them. And we're going to hear from colleagues who've been working in the hospital, but we have to remember just how difficult it's been for NHS staff. And these have been the themes of our campaigning work as NHS campaigners. We've, throughout this COVID crisis, both Keep Our NHS Public nationally and our Save Lewisham Hospital campaign have done a lot to support NHS staff and to support and to show our gratitude to them and to help us, you know, increase their morale. We've also campaigned to make sure that they get proper PPE. We've supported various efforts to do that. We've campaigned against the horrible privatisation where, you know, contracts for things like PPE and also test and trace have been given to the Tories' mates. I mean, that sounds a bit, you know, lefty, but it's actually just the truth, because even the Audit Commission have said it's astonishing that people who knew a Tory MP got fast-tracked and were 10 times more likely to get a contract. So this is the disgusting reality of privatisation. And it's not even as if they were competent. I don't think we would have minded had they been competent, but they, you know, we've seen the failures of the PPE distribution early on, and the test, trace, isolate and support system is still failing us, and we've got to keep on campaigning on these issues. I read today in The Guardian there's been 1,243 COVID deaths since yesterday, and that's 413 more than last week. So it's really grim news, and we're still really on the uptick. And apparently there are tens of thousands of NHS staff off sick, either with COVID or isolating. So in this context, it's quite natural to feel that things are just very, very grim. And certainly as a GP, we're seeing it's very hard to get ambulances for our patients who are ill. We've had a 5-6 hour wait when we phoned for an ambulance for a very sick patient. The ambulance service said they just cannot meet the demand that's current. And we've got very worried patients, and we also really struggle to find the ways of giving them the care they need. there is light at the end of the tunnel, and I think that's very positive, which is the vaccination campaign. And our practice has been involved in this, and I was giving the vaccines on Saturday, and I will do so again on Thursday. And that was great. That was really, really positive. There were people, mainly people over 80. They came, you can see, some of them could hardly walk. Many of them were really dressed to the nines, just to sort of show that this was a special occasion for them, both because it's the first time many people came out in 9 months, but also because they really valued the opportunity to get the vaccination. And I think it shows that, I think it symbolizes hope. I think we shouldn't, while we should be hopeful, I think it's important to counter the idea that the government's putting about that, oh, well, we don't need to bother doing anything else now because there's a vaccine out. Of course, it will take many, many weeks, if not months, for the vaccine effort to actually bear fruit. We're vaccinating the highest risk people, highest risk of death if they get COVID. But actually, they're currently not the people who are most at risk of having COVID. The COVID is circulating more in younger age groups and middle-aged age groups. And actually, the ICUs are full of middle-aged people who are at risk of dying. And this is likely to be the case for the next few weeks. So we still must make demands on government. What I'm hearing is the government's trying to blame the public for not complying with various rules. But a very interesting BMJ article the other day shows that 90% of the public are complying with the lockdown requirements. 85% actually support the January lockdown. So you're hearing all this stuff about COVID denialists, but that's because the media exaggerate these people in order to, it's good copy, isn't it? The unfortunate thing, it creates the impression that people are flouting the rules all over the place, which undermines confidence in them. But actually, 85% of people are following the rules, and 77% think it should have happened sooner. So we've got a population that is broadly supportive, and we've got a government which is still trying to blame everybody else but themselves. There's been a series of failings, and we have to now make sure that over the coming weeks, we put pressure on them. We continue to put pressure on them to make sure it's an effective lockdown, to sort out what's happening in the schools, because a lot of the children are having to go back to school because they don't have laptops, etc., to work at home. So we need to really push on that issue. We have to make sure that Rishi Sunak, and I did actually have palpitations when I saw him in this. I couldn't believe how angry I felt. He should be people should be supported properly to self-isolate if they have COVID or they're in contact with somebody with COVID. Because, if you're not going to get paid, then you're not going to self-isolate, because you have to put food on the table. It's people on lower incomes that are least likely to be able to self-isolate. So this is a social issue, and we must put pressure to make sure people are supported to self-isolate. And we should also, the Treasury should also be supporting small businesses as well. We have to get the test, trace, isolate and support system working properly. It's still not working properly. And again, it's a complete failure of the privatized system. There's the great thing about the vaccination effort, there's something like 800 to 1,000 GP centres that are vaccinating, plus 200 hospitals. And okay, they've opened 7 of these mass vaccination places, which is good. I'm certainly in favour of that. But the core of the vaccination effort is going to be from the NHS. And I think this does show that, our NHS is strong, and it's full of, on the day I've acted, lots of people have volunteered to help, not to give the vaccine, but to help to, shepherd people around and support the whole process. And I think it was just a wonderful community effort. And I think, when NHS is given the resources to do it, it can do it. And this idea that we should be giving all this billions to private companies, when in fact we should be supporting the NHS in the fight against COVID. That's one of our main political demands as a campaign. I think I've probably gone on beyond 5 minutes, have I, Tony?
Well, if you don't mind winding up, that's great.
Yeah. So it just shows what can be done when the community pulls together. So that's a very strong, positive thing to take from this. We've got a fight on our hands still, and that's really what today's meeting's about, how we can better organise in order to carry on this very important fight for this hugely important issue. Thank you very much.
Thank you very much indeed, Louise. That's really good to hear right from the front line GP frontline. The next is the message from Ben Travis. And welcome to Susan Michie, by the way. Thank you for coming, joining us. Video from Ben Travis, who's the Chief Executive of Lewisham and Greenwich Trust. The video that he put out to staff from last week. And he's given his permission for us to use it. I hope you can all hear.
Regarding COVID. So, I mean, it became clear just before Christmas with the news of the new strain that COVID was spreading much, much more quickly than had been predicted over the summer and the autumn, where we'd been advised that the second wave was likely to be less intense than the first wave, but to last for longer than the first wave. And as we all know, the way things are playing out at the moment is the second wave is far, far more intense than that first wave. And we are expecting that to last longer than the first wave did as well. So over the last week, we've been averaging about between 400 and 450 COVID positive cases. I think it might be a slightly false position in that we did have the 48-hour ambulance diver away from the QE that put a lot of ambulances into the centre of town. So we are expecting the rates to continue to rise. Our critical care units are extremely busy. So this morning we've got 31 patients at QE and 27 at Lewisham. So it's really putting an enormous strain on our colleagues, as I'm sure you're all aware. And we're also extremely tight on beds, which is the way that we have been over the past couple of weeks. So things are still that we're getting is that 1 in 40 people living in London at the moment currently have COVID. And some newspaper reports are even saying that might be as many as 1 in 30 people. And so it really is just making everyone aware, if you're not already, of just how rampant COVID is at the moment and how it is absolutely everywhere. So please, please do be extra specially careful today, tomorrow, over the coming weeks, around making sure we're doing all the things around social distancing, mask wearing, hand washing, and all those other things, because, you know, with the rates which are so high, and a virus which is spreading so quickly, I think we are all at risk of either getting it or transmitting it. So please, please do be careful. We have really been working very, very hard over the past 2 or 3 weeks with our partners and internally to try and respond as best we can to the current position. So as you'll know, we've opened up pretty much beds in pretty much all the areas that we can. We've been working with our partners to see if they can open up beds for us, and they've been really supportive around that. And we've also been working on some pathways so that we can discharge people a bit earlier than we might have done previously, but with the right support in terms of oxygen and the support around them in the community. And that is starting to pick up as well. And there's also an awful lot of work taking place in our community services and with primary care to try and get to a stage where people don't need to come into the hospital in the first place. But it's still extremely difficult, and we're going to have to progress all those programs as quickly as we possibly can. In terms of looking after ourselves, people will have seen hopefully that we've really been stepping back up the wellbeing program. On the PPE front, we absolutely have enough PPE. It might not always be in the right place, so if you get to an area and you don't see what you need, please let the site office know, and they will be able to get some stuff for you very quickly. So we do have the PPE that we need. On a real positive note, the vaccine rollout, the first 2 weeks of it at Lewisham has gone extremely well. We used up all the doses that we have, which is 1,950 doses. All of those were used up, and the vast majority of that was used on our highly vulnerable, our vulnerable colleagues, and also colleagues who are working in high-risk areas. And we're very much hoping that we'll get delivery of the AstraZeneca Oxford vaccine at the QE sometime towards the end of next week, but we just are awaiting the official confirmation around that. So we're absolutely ramping up that vaccine program as quickly as we can lay our hands on the vaccine, so that the vaccine will be available for all colleagues over the coming weeks. Finally, as we go into another weekend, I just wanted to thank you all for all the incredible work you're doing. I absolutely understand and have seen firsthand many, many times over the last couple of weeks how challenging things are. We've absolutely got to keep going. As I've said before, this is when our local population really needs us to step up, and step up you all have been doing, but we've just got to keep going. Thank you very much.
Right, well, thank you very much. I hope you valued that short video. We thought it was important to show the relationship between the campaign and the NHS locally that we're fighting for. As I said before, we saved the hospital, and if we hadn't saved Lewisham Hospital, it would have been even worse than it is at the moment. Several of our campaign members are in the Lewisham and Greenwich NHS Trust as health staff, and in fact, unfortunately also several members and a close retired friend have got corona, and one of them is in intensive care at the moment. So the survival of the morale and the endurance of the NHS staff locally is very important. We heard today that the leaders of Greenwich Council and Lewisham and Greenwich Trust have jointly supported the launch of something called Project Hope, writing to local residents and local businesses. I think in Greenwich, there's already a network in Lewisham to support the local NHS. And the message was that this is the most serious it has ever been, and bodies wanting to support local communities should get in touch to support local NHS services and staff who are currently at risk of being overwhelmed. So we're going to go on to welcome now Dr. Sonia Adasara. Sonia has been a member of Keep NHS Public for the last 3 years or so. She's a member of numerous organisations, which I won't list, but a great campaigner for women's rights, for the rights of migrants, and for the BAME community, particularly during this pandemic. She's been very brave in her outspoken messaging on social media and in national interviews on television and radio. So welcome, Sonia, to tell us a little bit more of what it's been like at the front line and your messages to go with it. Thank you.
Thanks, Tony. Hope everyone can hear me. My mum says that people just on my social media, I'm not as angry in real life as I am on Twitter. I tend to just tweet when I'm angry. So I've been asked to tell you a bit of what's going on in the front line. So the hospital that I work in, we've actually been starting to see cases increase from the start of December. But it was a set of night shifts that I did just before Christmas when the situation became very serious and quite frightening. So by midnight, we ran out of CPAP capacity. So CPAP is the machines that we use to help people breathe who are really sick. And then I guess just since then, every shift it's been becoming more and more difficult. So our ITU is full. In our A&E department, we're having to put 2-3 people in each cubicle because of trying to relieve the queues of ambulances that are lining up. And just the sheer numbers of people that we're admitting is just off the scale. And it is extremely stressful. It's upsetting. I have never in my career worked in conditions like this. I've never seen as much death as I have over the past few months. And I'm very angry. And I'm angry because on those set of night shifts that I did just before Christmas, I knew that the people who were being admitted to hospital who were really unwell, they would have got the virus 2 to 3 weeks beforehand, at a time when we know that our shopping malls were just completely full because our Prime Minister was telling everyone that we were going to have a Merry Christmas. And I'm angry because just again, just the exact situation that happened in April, that over the next fortnight, we are going to again see tens of thousands of deaths because this government refused to act until it's too late. And I'm angry because, you know, I can say in London, our hospitals are on the brink. We are close to full in intensive care capacity. And still this government does not seem to get the basics right on infectious disease control. You know, so they don't seem to understand that we need to be supporting people to isolate. And so my sister, she works in general practice, and she keeps hearing the same thing that we've heard over the past few months, that, you know, she has patients, they've got symptoms, and yet they tell her that they can't isolate because they simply can't afford to. And again, you know, the most recent Public Health England data showed the exact same thing that was happening in the first wave, that it is the poorest communities, ethnic minorities that we're seeing the rates of the virus increase at the fastest rate in this country. And then, you know, I thought I'd try and end on a positive note. And I think, you know, I do think there's things that we can learn from this pandemic. And I know I'm, you know, definitely talking to a converted audience here, but hopefully, you know, after this pandemic, I think the critical importance of having a well-funded, well-resourced, well-staffed health and care service, you know, I hope will just become, you know, ingrained into the public psyche for a long time. I think this pandemic has also, you know, really shown us that freedom from sickness is not simply reliant on health infrastructure, but it's also, so I guess, you know, for, you know, us as health campaigners, you know, we need to be thinking about policies affecting housing, policies affecting rights in the workplace, policies affecting the environment, the air that we breathe. All of these things impact our health. And, you know, we've also got, you know, another crisis in the background, the climate crisis. And, you know, I guess things have happened this year, and policies that have been implemented that we were told were impossible and completely unachievable. And I hope we can take from this that actually this is now the time that we should be bold and ambitious with our demands to deal with the multiple crises that we are facing. And lastly, this crisis has really highlighted our interconnectedness. And again, I know I'm talking to the converted audiences, but policies such as the hostile environment, where people living on our streets are excluded from healthcare, are not only, you know, in my opinion, utterly inhumane, but they're also dangerous. And I think this is my final point. I think a real sort of ray of sunshine that's been over the past few months is actually, we have seen the medical and the scientific community across the world, you know, cross borders, work together in a united fight against this virus. And we've seen the accumulation of that with the vaccine. I'm just gonna have some water for my throat sore. And again, but you know, it's a shame that our government undermined this amazing achievement with their sort of nationalist nonsense when they paraded the vaccine. But you know, I do hope as well that we again learn the lessons. And I think it's unfortunate that we are already seeing vaccine nationalism, and you know, majority of the vaccine supply has already been, you know, bought up by the richest countries in the world. But I hope we can, you know, particularly now urgently start thinking about a fairer way to deliver the vaccine, to ensure that, you know, vulnerable communities in less fortunate parts of the world are not left to suffer and not sacrificed. I'm going to stop talking now because my voice is going, but I'm at my 5 minutes, so thank you.
Thank you very much indeed, Sonia. That's very good of you. And I do admire all of you on the front line, how you're keeping going. And just, I'm lucky to have retired now. I'm getting a guilt complex for knowing what you're going through. But thank you very much. I'm going to go straight on to Dr. Lola Fakoya-Sales and Dr. Aaminah Verity, who are also frontline doctors working as GPs. Again, the government's completely bypassed GPs and sidelined the importance of primary care. But Lola and Aaminah are also working in Lewisham Hospital, doing shifts in A&E as part of their training. So thank you very much for sharing your experiences here now.
Oh, thank you. So hi everyone, my name's Lola. I'm a GP registrar, so that's just before being a fully qualified GP, working in Lewisham, and I was actually working in A&E for a year last year up until August, so I was there in the first wave of the pandemic. And then last week, having received quite a few messages from friends who work in A&E, both doctors and nursing staff, I sort of volunteered to come and help because there's so many staff shortages. At the moment, people are sick, having to isolate just because of the spread of coronavirus, that the staff who were remaining were just overwhelmed. And I think what struck me on Tuesday, which is when I went and did an evening shift after work from the GP surgery, was just the sheer amount of sick people in the hospital. And I think, as Sonia was saying, you know, having two people to a cubicle, not having space to see people in the resuscitation area, and also the ambulance crews not being able to unload people on that Tuesday because it was just so busy and there wasn't any space. And the intensive care beds being full. So doctors having to make quite difficult decisions about resources like CPAP and intensive care beds, which they probably wouldn't make before. And so I've got a dual perspective because I work in primary care in a day job. So I'm the doctor talking to people on the phone, assessing people over the phone, or doing a home visit and deciding whether they need to go to hospital. So when I call LAS and they say it's a long wait for someone to get to the hospital, that puts quite a burden on us as healthcare professionals, especially with breathing problems. I can't really describe how it feels to listen to someone having difficulty breathing over the phone, and to say to them that the ambulance is coming, but I can't tell you when, which is what I did today, because it's very hard. And also in primary care, we're seeing the mental health burden of coronavirus hugely, lots of anxiety and depression amongst our patients, especially because they're isolated, and in general, any pandemic is going to raise your anxiety. And just, sorry, I'm getting a little bit upset. And that's just very hard. And so you can understand why after sort of 10 months of this, why staff are having quite a low morale, why there's burnout amongst staff. And it's hard, especially when, you know, a lot of, I have the privilege of being able to go to A&E and pick my shifts when I need help. I'm not working there full time, but I do know that my A&E colleagues, my medical colleagues, the nurses, they've had their leave cancelled for January and February. I was speaking to a nurse on Saturday when I was in A&E, and she was just saying, you know, I haven't had a break for months, and my leave at the end of January has been cancelled because they have no one, you know, that they're staffing zones which normally have 5-6 nurses with 2 nurses just because of the staff shortages. And I think I would reiterate what all the other doctors and everyone's been saying today, is that this is definitely something that has been mismanaged completely by the government. And we always know that there's going to be winter pressures, and actually we could have prepared better for that as well in the summer and leading up. I'm going to leave it there, actually.
Well, thank you so much. Thank you very, very much indeed, Lola. And we feel for you, but going straight on to your colleague, Aaminah. Thank you. Welcome to Aaminah.
picked up just looking at Lola feeling that as well, because I think we all we're all feeling the same way. So I'm a GP. I actually qualified as a GP during this pandemic in August, so it's been a crazy time to fully qualify and suddenly be thrown into the workforce as a new GP, one of the promised 5,000 that the Tory government said that they were giving. I did all my training in Lewisham and did my first year out of medical school in Lewisham. So I've been around this area and with our patients for a really long time and have a lot of love for our community. And what we're seeing is it's just devastating, really. I've been working as a salaried GP in South London, and as Lola said, you know, we're dealing with kind of mental health burden of our patients, trying to support people going through coronavirus. The amount of different directions we're being pulled from, you know, now trying to deliver the vaccine program. And, you know, I do echo Louise's thoughts that it is, the NHS can do it and it is a lovely thing, but actually I don't think it's been properly funded. I don't think it's been properly resourced. And what they're asking for is for us to lose GPs once a week to go and vaccinate in the clinic, which leaves us understaffed on the other side. We don't have the capacity to be doing everything. Because I only work a few sessions, I've been doing some shifts in A&E as a GP, and what they've asked for is basically, as GPs, whether we can be at the front door assessing patients walking in with possible COVID symptoms and other problems, and anyone who doesn't need to be in the hospital making a decision to try and turn them away as quickly as possible at the front door, and using our skills as GPs to kind of make that decision without having to get tests and blood tests and the other things that the more junior doctors would need. What happens is it's incredibly stressful. We're in the full PPE. 2 of the GPs working in that role got COVID from doing that because of the high volume of patients that they were seeing in different PPEs. So they've now asked us to wear the full FFP masks because they've thought that it was quite high risk, the work that we were doing. And it's just quite emotionally draining to sit and you know, people are really anxious, and that's why they're coming to A&E, or they might have been sent by their own GP, or they might have been sent by, you know, a remote monitoring service saying, you know, you need to go to A&E and get checked. And we're trying to make kind of a 10-minute, 50-minute assessment to say whether or not you're safe to go home and manage conveying that to people with language difficulties who maybe are vulnerable. But also, you know, that there's no space to take them in and do anything else. So at least you can provide some relief for the hospital to get people who don't need to be there away. I think, you know, the other thing that I saw the other day when I was in Lewisham, which made me really, really sad, was one of the patients was a cleaner from the hospital, and she'd had an episode of feeling really unwell, and basically her boss was forcing her to go and work in a COVID area, despite the fact that she was elderly, high risk, in lots of different ways, lots of medical conditions, and she just didn't have the support from her. She hadn't been vaccinated, and that's because it's a privatized cleaning company that isn't under the NHS, that isn't part of the Lewisham Hospital. It's a contracted company, and she didn't know if she had a union. She didn't know if she was able to how to get support. So we just talked about, her contacting her own GP to get a sick note to kind of give her time to organise that. But it just made me really sad that, even our own staff are most vulnerable. And it's exactly what Sonia was saying, and Louise, that the people who have to work and they're being forced into these situations where they're having to work, even though they're high risk of getting COVID and high risk of dying from it if they do get it. I think, the government has a lot to answer for. On a positive note, as someone who is hopefully going to carry on being a GP for for a number of years if we get through this. I think that, you know, hopefully the public will see how important it is to have a working and functioning healthcare system. And I think about the poor people in America who are going through what they're going through without knowing that they can rely on their healthcare system. And I think when we have moments like there's a 6-hour wait for the ambulance, you suddenly have this glimpse of what it's like to not have a functioning healthcare system. And that could be the reality every day, all day, every day. But we have the NHS. It's beautiful and precious, and we must do everything we can to make sure that it stays functioning after this. Thanks.
Again, thank you so very much. And that is an amazing testimony from all of you about the NHS and the issues relating to it. We're going to go on to schools now for the next section. Our original intention behind this meeting was to join the call for a serious reversal of government policy to close down schools until they are safe in not just in terms of safety of children, not just in terms of safety of teachers, but also in terms of their contribution, necessarily so, to the spread of virus in the community. The government then did one of its many screeching U-turns, which is not funny, it's not great, it's a disaster of public confidence. But now we've got several more speakers. We're lucky to have Duncan Morrison, who's a teacher at Deptford Park Primary School, where I used to go sometimes as a community paediatrician, and he's secretary of the Lewisham National Education Union. And I have to say that the National Education Union has shown us magnificently what a union is there for, and it has been brilliantly important during this campaign. So welcome to Duncan.
Thank you, Tony, and thank you for having me at this meeting. Obviously, school workers who I represent aren't at the sharp end in the same way that our colleagues in the NHS are, and I wouldn't like to pretend for a moment that we're experiencing the same stresses as those working in hospitals. However, it has, since the first lockdown in March, it has been a hugely stressful and anxious time for those of us working in schools. As you will have noticed, schools have barely been out of the news cycle in all that time. Constant rumours of opening and closing, and holidays disappearing, and exams disappearing, and exams reappearing. Every time there's a news cycle, it sends a frisson of anxiety through school workers. And I want to clear up some myths, ones I don't suspect are held in this meeting, but are maybe held in amongst the politicians and amongst the right-wing press. Schools don't only have children in them, they have to have adults in them. And the adults who work in schools are not all white middle-class teachers. There are some of my members are amongst the lowest paid workers in the country, support staff who are paid termly on wages that, if you average them out, are lower than minimum wage. And our concern throughout this has not been about protecting us or just our school communities. It has been what Tony alluded to when he introduced me, which is that schools, children and students who come to our schools go out back into the community. And if you bring them together in conditions that throughout the autumn, we have been having 28, 30 children in a classroom in conditions where you weren't able to wear masks at that point, where there was a lot of people in a confined area. There's nowhere else in society at this point where this was happening. But I want to take you briefly back to the summer, because in the summer, as schools reopened on a wider basis, the NEU wrote to the government, and the NEU wrote to the government and said, you need to start making some provisions. We need a plan, because we knew that the virus was, all the evidence was that the virus was going to come back in the winter. We said that the government needed to requisition school buildings. It needed to employ more school staff. It needed to make sure that online learning could happen. And the government absolutely ignored all of that. Their message back to us was that schools were staying open, so they didn't need to worry about online learning, and they would stay open, and that it was perfectly safe in the context that we were working in overcrowded classrooms with not enough staff to continue. And it was always inevitable that that was going to trip, I'm afraid. It was always inevitable without the new variant that that was going to trip. And you could see even before the new variant, across the country, school after school having to close or close large sections of it because of the virus spreading in the schools. To my mind, and I think to most of my members' mind, the counter position that has gone throughout the discourse around schools during the virus about open or closed is not the right one. The right one is we want our schools open, but we want them open safely and sustainably so we can teach our children. I want to clear up another myth. This myth is that we want the schools closed because it's easier for teachers. I am currently being overrun by school workers and teachers whose workload has absolutely gone through the roof since schools have closed. The notion peddled by the right-wing press, you know, that we all have huge holidays and we just want to extend these holidays is an absolute myth, and it's a disgrace. So, as you all know, in December, what became clear was that after being told for some time that children didn't spread the virus, it became very clear that the children did spread the virus. And not only that, with the new variant, they seem to be the prime spreaders. So there's Office of National Statistics data for the last 2 weeks of December, which show the two highest groups were the younger groups in secondary school and primary age children down to the age of 2, so in nurseries as well. And that meant that we got to a point where there was a crisis, essentially. The government wanted to open schools, and we advised our members around their individual legal rights under Section 44 not to go into workplaces that were unsafe. And as you will be aware, is not being recognised, but I think our action across the country meant that schools did close on January the 5th, largely. And I think that's because the government was faced with a very real decision, which was that the people working in the schools were taking control of the schools and saying these are no longer safe, and we're going to open them on a basis which means that they are safe. We now have a number of issues which I just want to talk to you quickly about. We have the issue which the government, in its own unique way, closes schools, but then basically messages saying, well, all children should be able to go into schools. So we have this problem of large numbers of children coming back into school because the messaging is so unclear. We have particular issues around special schools and particular issues around nurseries. The issues around special schools are that all their children are vulnerable, and yet all their children also, many of the students exhibit behaviours which make them a higher risk of transmitting the disease and put the staff in and the communities around those schools in greater risk. The nurseries are being kept open by the government, and their funding is being threatened. And they say that's because nurseries don't spread the disease. However, our union has repeatedly asked them to show us the science on that, and they have repeatedly refused to show us the science on that. And I'm sure, like many people in this room, if we're not being shown the science and the government just states they know it, we don't frankly believe the government. So we have struggles over that.
1 minute.
I will. What I'd like to say is the way I believe we could address this, the way the NEU believes we could address this, is through the organising in our workplaces, organising in our schools. 16,000 members joined the NEU last week. Our membership has grown massively over this year, and we intend to protect our schools, our wider communities and our NHS by carrying on organising in that manner.
Thank you very much, and well done locally and well done nationally. And can we go, I just want to say that there are 76 people watching the meeting, taking part in the meeting, and we're very pleased with the result, and thank you very much for joining us. I'm going to go straight on to Vicky Penner and Emily Penner now to share some of the issues that they face as parent and a family and a child in a secondary school in Bexley in Kent. So welcome to both of you, and thank you very much for joining us and giving your family, parent and child perspective, parent and young person perspective, I should say.
Oh, thank you. Hello, everybody, and it's quite an honour to be asked to speak tonight. I'm a mum of 3 kids. Emily is my oldest, and you are going to give a bit of a perspective on what it's been like being a student at school that has had a massive COVID outbreak in the month. It's very frightening. So Emily's going to talk about that. We all know in Lewisham that when Jeremy Hunt starts sounding sensible, we're in big trouble. That was the situation with schools, particularly over the last few weeks, has been nothing short of ridiculous and fairly unforgivable as well. My feeling as a parent, and I think I speak to lots of parents that say the same thing, we genuinely feel that since last March, teachers and schools have gone above and beyond normal expectations to protect their school communities, to protect their pupils, their staff, and the wider communities. And to be honest, the schools themselves have often blown us away with their resourcefulness and their dedication. And there's too much manipulation in the press going on about what's going on within teachers. And I'm really pleased Duncan put some of those things right. We all know, particularly in this group, the catalogue of government failures. My personal view is that teachers, pupils and families have quite recklessly, and communities quite recklessly, been put at risk by a thoroughly incompetent government.
I'm sorry, I think we'll unless people are losing me, I'm Vicky.
Is that all right?
You just broke up a bit there, but you're back again. Keep going.
Oh, sorry. The lack of equipment for pupils, the lack of Wi-Fi access. The government have now had 10 months to sort this out, and we haven't seen enough progress on this, and we're back in another lockdown. The constant U-turns, the threatening boroughs legally before Christmas is nothing short of ludicrous based on what has happened subsequently and what has had to happen subsequently. And basically, I feel quite angry as a parent at the utter lack of basic planning by government. So the teachers and the schools are doing an amazing job in almost impossible circumstances. And the Department for Education just seems to be thoroughly letting the schools down. The guidance is contradictory, it's confusing, it changes daily, it contradicts their own public health documents. This whole concept that the strategy rests on repeating government propaganda and rhetoric. So all we heard over the autumn was how safe schools are, how COVID secure schools are. It wasn't true. We all know it wasn't true. The mental health issues with children having to be at school. Well, in normal circumstances, many of us parents would agree with that perspective, but we are not in normal circumstances. We are in the most unprecedented circumstances. Other schools have been put in an impossible position. Teachers are trying their very hardest to keep pupils, staff and families safe, but this one size fits all approach is faintly nonsense. You know, when term started in September, after 6 months of lockdown, different schools could approach things differently. There might have been differences between primary and secondary, for instance, with the sheer volume of students. But certainly when you look at the majority of secondary schools, this bubble size that was enormous, the packed corridors, the children moving, some of the very basics from the Department for Education were missed out. The concept of space, it is impossible to distance in most secondary schools, impossible with all the students there. So I think from my point of view, there was something Duncan said that I agreed with, that I find it really sad that the rhetoric is schools are open or closed. It's absolute nonsense. When children are learning remotely, many children are actually learning remotely. It doesn't have to be all or nothing. That's a Gavin Williamson myth. Blended learning is perfectly possible if government puts the right things in place as far as equipment and Wi-Fi. I feel really strongly that school spread of infection cannot be allowed to run riot again like it did in November and December. There is a super spreading danger to the whole communities with that. I personally believe that one of the reasons we're in such a serious situation now is because the government mucked up as far as schools were concerned. As a family and as a parent, I'm not high risk. So I thought, well, my children should go to school and get an education. By the time we broke up for Christmas, we just decided, you know, we may not be super high risk in this family, but we have a vulnerable grandfather and we don't want to play this government version of COVID roulette anymore. And neither should any family and neither should any member of staff. How do we trust the government of what's happened? And I think I will struggle to trust the government, but basically schools have been up against a tsunami of difficulty and done their very, very best in impossible circumstances. As a parent, I'm not happy with my kids going back to school until there is accurate and reliable testing in place. I have zero confidence in the lateral flow tests because they're talking issues. I think it's risky. I'd like to see teachers prioritised for vaccinations. I'd like to see sensible replanning and reopening of schools with proper procedures in place to prevent transmission, urgent hand washing, limited movement, reducing numbers, blended learning, rotas. You know, it doesn't have to be all or nothing. There are sensible things that can be done if the government gets a grip. Just repeating schools are safe is not good enough as far as the strategy is concerned. It doesn't need to be binary, common sense needs to be applied. Keeping kids in school at all costs did not work last term. Look where we are now. Government have got to start consulting with teachers, with unions, with parents, with vulnerable families. They've got to listen to people. They've got to recognise the difference between education settings, and they've just got to do it better, really. So that's my views on it. I'm going to pass you on to Emily to explain what it's been like in her school.
Hi, I'm Emily and I'm in year 9 secondary school. I want to try and explain as a student what term was like last year and why I think schools should continue working remotely when COVID infections are so high. Unfortunately, my school had a massive COVID outbreak last term, going from 1 to 70 or over positive cases within just 2 weeks until public health finally stepped in and closed the school. Throughout the first lockdown, our teachers worked really hard to give us a good education from home. We were really excited to go back to school in September and see our friends and teachers again. But it was really weird when we got back to school. After 6 months of being so careful with social distancing, suddenly we were in big crowds of over 1,000 people again, with packed corridors and sitting in classes literally shoulder to shoulder with up to 32 students. It was really unnerving. I was conscious all term that anybody I passed in the corridors could be carrying COVID-19. And it was an odd combination because in the first term, lots of us relaxed a bit because it felt normal again and we were allowed to socialize with all our friends. That was until the infections really hit us hard and people in my class and in my year started getting ill. I knew that if one person had COVID-19 and brought it to school, it would spread very quickly. Sadly, I was proved right. The government kept telling us all that schools were safe. They wanted to keep us in school at all costs because education is so important. However, once students start catching COVID, their learning and their mental health suffers. The girls in my class got scared. I got scared about bringing this virus back to my family, my community, and especially my granddad. We were scared in class for our friend who has an underlying condition. She was unnecessarily exposed to COVID during this outbreak and ended up in hospital. She was pressured to come to school because it was safe, but it wasn't. Online learning can be great. The idea from the government that students don't learn from home is nonsense. If students have the right equipment and Wi-Fi access, which the government have a responsibility for providing, decent learning is possible, and lots of schools and teachers are doing an amazing job in really difficult circumstances. I'm not looking forward to going back to school unless it feels a lot safer. The government needs to plan better. I don't want to be packed in corridors, and I don't want to be exposed to COVID-19. Even if students my age don't usually get dangerously ill, we can still spread it to people who will. That's the real danger.
Thank you very much, Emily. And I should have said that the Penner family have been fantastic from the beginning in our Lewisham campaign, and Vicky has been our press officer with amazing impact. And like mother, like daughter, fantastic communicators. Thank you, Emily. I'm going to, we've had many speakers, I think fantastic speakers. We've got two more, and I hope everybody has enjoyed it. I know there's less time for discussion than in some meetings, but I'm going to go straight on now to Hera Lorandos, the Campaigns and Communications Officer for Lewisham Refugee and Migrant Network. And I think we all probably know that one of the vicious aspects of the hostile environment has been the exposed vulnerability of migrants during the COVID campaign, when they are terrified of going anywhere near the NHS in case of Home Office repercussions and bills. Hera, welcome.
Thank you so much for having me. Yeah, so as Tony said, I'm the Campaigns and Communications Officer at Lewisham Refugee and Migrant Network. And I wanted to talk about kind of the two aspects of schools and the kind of the effects on just everyday lives of the people that we work with, and also our concerns around the vaccine distribution. So from the start of the pandemic, obviously a lot, we were plugging the gap, you know, and LRMN was supporting, we've supported hundreds, if not thousands of people since the pandemic has began. And we've really seen the situation go from bad to worse. A lot of the people we work with are people really in the most extreme situations you can imagine. Even, you know, from all the way from asylum seekers who, because we deal with such extreme situations, we consider asylum seekers to be some of the more privileged ones, all the way to people with more irregular immigration statuses who don't have access to public funds and are really in quite dire situations. And so people who were kind of living in temporary accommodation or living with friends, you know, sofa surfing, that kind of thing, really saw all of their normal support networks just close and shut down. And that's why we've seen a huge rise in demand for our services. So we've been doing things like food parcels, you know, giving out essential items and just hardship funds. And you can imagine what kind of desperate situation people are in, because they're risking catching COVID, taking buses from across London to our hubs to collect food parcels. And we've seen it go, and definitely with this last lockdown, we've just seen people don't even have money now to pay for the transport to get to the food parcels and asking for delivery, which we don't even have capacity to do anymore. So it's really, really gone from bad to worse. And in terms of how it's affecting families, we can just see just the biggest issues around digital access. You know, people living in temporary accommodation for extended periods of time. You know, normally something like, you know, an asylum seeker would only live in a temporary accommodation, maybe, you know, in a hotel for 2 weeks, are now living, you know, almost a year, you know, about 6 months now, and with very little Wi-Fi access, if none, and using, you know, data packages to educate their children. And it's kind of fallen on LRMN to, you know, try to find laptops and pay for data, pay for Wi-Fi, which is obviously something that we expect the government to be doing. And it's really put a huge amount of stress on parents, because not only are they sort of trying to overcome a digital, you know, barrier, they're also overcoming language barriers, you know, different education systems, and trying to just navigate this whole pandemic with even less support than you can imagine. And you put on top of that migrant charging, which, if some of you don't know about, it's a lot of people living in the UK permanently are now being charged for healthcare and are facing upfront charges, and if they can't pay for their healthcare, are sort of berated by debt collectors until they do pay. And this has really forced a lot of people into destitution, which is the obvious effect, but the biggest and most concerning effect is that it really is deterring people from seeking care. And unfortunately, through our community, we've even heard of some people dying from COVID-19 because they are too afraid to go to the hospital and be charged for care. And you now take all of that context and think about the vaccine distribution. And this is when we start sounding a little bit paranoid, but we are very concerned around the vaccine distribution, and, you know, the very real fear that if people go and, you know, go to a vaccine center and, you know, want to get vaccinated, their data will then be given to the Home Office, and then that data will be used to basically find them and remove them from the UK. And this might sound a little bit paranoid, but we know that this happens, that data sharing does happen. And it's something we really need to think about when we're asking people to be vaccinated. And obviously we want everyone to be vaccinated. And then also the other thing to consider is GP registrations. A lot of people, again, choose not to be registered with GPs because they're too scared that they will be eventually charged for healthcare or be reported to the Home Office. And or another even sadder thing is they, you know, call the GP's, you know, reception, and they say, please, can you register me? And they say, sure, show me your passport, show me your permanent address, which is something they do not need to be doing. And this happens regularly. A lot of people aren't registered with GPs because of this. And so they're going to be left out of this rollout. So in kind of, I don't know how long I've spoken for, but we are going to be working on this really hard, and especially at a local level, and we have alerted the council to this. So hopefully together we'll be able to make sure that everybody get vaccinated and no one is put at risk because they're just trying to seek medical help. So yeah, that's for me. Thank you. Thank you very much, Hera. That was lovely, very, very clear and very important messages, adding to a whole number of amazingly powerful messages we've heard tonight. I don't know if you've been watching Independent Sage, but I think it might be good for you to contact them and ask a question about vaccines and access to the migrant community for healthcare and vaccination. But that's my segue into welcoming Professor Susan Michie, who is Professor of Health Psychology and Director of the Centre for Behaviour Change at University College London, UK. And she's a member of Independent Sage, and I think I've forgotten this, but of a subgroup on psychology advising the official Sage. So very, very warm welcome to Susan Michie, and thank you for joining us, and thank you for being here for the whole meeting, knowing how busy you are.
I hope you're still here.
I am indeed. I'm delighted to be here, and thank you for the invitation. And congratulations to the campaign. So important to have campaigns such as yourselves. And great meeting. And I'm very humbled by the many fantastic contributions that I've heard this evening, really giving the human element as to what the situation is. So in the few minutes I have, I really wanted to pick up on the situation we're in at the moment, which we're all too painfully aware as to quite how desperate it is in terms of the health service and what we're going to be witnessing over the next few weeks. And we're also very painfully aware of the fact that it didn't need to be like this, and that many other countries around the world who have different kinds of governments and different kinds of approaches are now leading a relatively normal life. We are where we are, and one of the issues that we're facing right now is the level of restrictions that the government have suggested we follow. And compared to March, when we had the first lockdown, we have higher rates of transmission and steeper increases. We have a variant of the virus that's 50 to 70% more infectious. And we have cold weather, which means the virus lasts longer and we spend more time indoors. And so aerosol transmission is a much bigger danger. And we have an NHS that, as we've heard, is on the brink of collapse in many cases. For all those reasons, we should, if anything, be requiring a stricter lockdown rather than a laxer lockdown. And what we have at the moment is a range of super spreader events. We have nurseries open, we have places of worship open, we have athletics, sports events open. We have such a wide range of what are now defined as critical workers that 68% of the population are going out to work. And so many people are now critical workers that schools are reporting 50% occupancy. So we have big transmission going on there. And in this situation, we are, and I should also mention that we have a lot of household transmission routes with people going in and out of each other's houses for being non-essential tradespeople, nannies, cleaners, etc. Now, all of this means that people are going out and about. 42% of people are out to work, and that means public transport is much more full, more super spreader events. I'm involved in research showing quite how much is going on public transport. So all of these government policies are meaning that not only have the continual delays to lockdown meant that we have to deal with a much bigger problem with thousands of avoidable deaths, but it leaves us in a situation where it's going to take us much longer to now get out of it. And again, the government seems to be burying its head in the sand by just allowing so much interaction to go on. And I don't know if you've noticed, but the government's response is, rather than examine their policies, which is allowing people to come into contact with each other. And I have many, many emails every day from distraught people who are being forced into work when they feel it's unsafe. Of course, the government needs to give adequate financial and practical support to everyone to get us through until they properly deal with the pandemic. And that investment now is well worth it for the long term. But instead of examining this, learning the lessons from what other countries are doing, what the government's rhetoric and narrative, which has been really interesting over the last few days, and anybody who saw Priti Patel this evening will have seen the same thing, that the answer is to blame us, blame the population. It's not the rules that are a problem, it's you, because you're not obeying the rules. And So they combine blame with punishment. That is the strategy. If you look at the data, yes, there's not as much adherence as in March, but I think it's about 95, 96% overwhelmingly adherent. We're now down to about 80%. But that dropped with the mixed messaging over Stay Alert, and it dropped a huge amount with the Dominic Cummings affair, because people just saw that as unfair and hypocritical and a lack of good leadership. But adherence has maintained itself, has been steady since the summer, and it hasn't decreased. So I spent 3 or 4 days now on the media where they're desperate to get me to say that adherence is a problem and why is it a problem? And I say, you're asking the wrong question. Adherence isn't a problem. You should be asking, why are the rules so lax if we're serious about getting out of this pandemic? So that's the first thing I wanted to draw attention to. The other thing that I wanted to draw attention to is a real problem I think we've got in terms of the knock-on effects of the vaccine program, which is wonderful and fantastic, but it's not a silver bullet. The lateral flow testing that somebody mentioned earlier, and the fact that lots of people have had COVID. My concern is that there's very poor messaging, and people who are having the vaccination are not necessarily realizing that they're not protected. They're not fully protected. So I spoke to my dentist, he's head of the practice, a very intelligent man, a couple of days ago. And he said, I've just been given the vaccine and in 8 days' time, I will be protected. I said, no, you won't. And he said, yes, I will. And I said, well, what do you think the second dose in 12 weeks is about? He said, oh, that's so I can be protected for longer. So I had to explain to him what the evaluations were, and the fact that we don't know that there's any protection up until the second dose, and also that protection is only anything from 65 up to 80, possibly 90%, but that's an average across the population. You don't know what it is for you. So, you know, the importance of keeping up with all these protective behaviours, I can't stress enough. Mori polls in December showed that people were saying that if they were vaccinated, they would feel they could relax more about the social distancing, the hand hygiene, all of these protective behaviours. So this is really concerning. On top of that, we've got the, oh, and I should say, when I talked to the dentist, I said, well, what did they tell you when you got the vaccination? He said, nothing. It was 2 minutes. The person didn't talk to me in and out. And I said, well, what did the leaflet you were given say? We weren't given a leaflet. So we're going to have millions of people vaccinated who think they're protected when they're not. And this is a potential disaster. On top of that, lateral flow tests, these mass testing, they are there for a purpose, only to try and identify cases to then help them isolate. Only 1 out of 2 people are detected, so 1 out of 2 people are missed. That's fine if it's just about trying to find people, the fact it's so inaccurate. But the problem is it's not properly explained. So people will think, well, if I have a negative test result, then maybe I'm less at risk. And this is what people are thinking. It's not properly explained. And then again, we have now increasing numbers who've had COVID. And again, there's an idea that if you've had COVID, you're fine. You're not infectious anymore. But we're having people with repeat COVID. So these are all really big problems. And I just want to end with drawing attention to one area where there is a real problem of adherence, and a really significant problem of adherence. And this is something my own research, which was commissioned by the Department of Health and Social Care. The government's been having weekly survey data from myself and my colleagues, showing that people who have symptoms, only 30% of them are isolating to the full period. So we have 70% of people with symptoms who are going out and about in the community in some way or other. When we ask them, why is it? It's for practical reasons. It's because they have to go out for their jobs to get income. They have to go out for caring responsibilities. They have to go out to get provisions. And the government's known this all the way along. Other countries pay people to stay at home. It's a job to stay at home and protect your community. Anything from 70% of income up to 100% of income. Other countries visit every day when you're isolating to find out, are you all right? Do you clinically all right? Do you need any practical help with getting provisions or dealing with your rubbish or whatever? And some countries, they offer psychological and social support. We get none of that here. Other countries offer free accommodation. Even poor countries like Vietnam. In New York City, they offer, and not, the United States is not one to offer free public goods, are they? But they're offering free local hotel accommodation, free transport there and back, free meals throughout, free Wi-Fi connection. You can take your children in with you if you need to, and they'll even offer pet care. Like, this is what you need to do to get on top of the pandemic. Separate those people who are infected from those who are not. Our test, trace and isolate system, we've heard of many of the failings of failing to ensure safe schools, where we actually need to have double the space by taking over lots of empty buildings that there currently are. And we need to get twice as many staff, recruiting a lot of teachers who took early retirement and other people with help, especially with the online learning, and making all workplaces safe. None of that has been properly done. But anyway, we've rehearsed some of the failings, but the biggest one is the test, trace and isolate system. This is the ABC of how you get out of pandemics. And all the other countries, all of the Southeast Asian countries, Australia, New Zealand, Norway in Europe, Kerala in India, Uruguay in Latin America, how have they got out of things? How are they back almost to normal? Test, trace and isolate. What did the government do? Instead of giving the resources to where we have the experience and the expertise of doing this, which are local public health infrastructure, working with primary care, they gave it to huge big commercial companies with no expertise, no experience, 12 billion pounds down the drain. Had that gone into the local, building up local public health, we would be in a very different place compared to where we are now. So anyway, we're not in a good situation, but I think in terms of going forward, it's absolutely imperative that organisations like yourselves, the communities get together and think about what are the problems, how do we solve them, raise the voices, and think not only about what is needed right now to make things better, but in the long term, we also need to think about coming out of this, which is going to be very, very difficult situation. How do we build something back better? This pandemic has increased what was already an incredibly unequal society, because it's hit those who are living in poorer, overcrowded, multi-generational housing. It's hit those who are actually the public facing and doing the work of keeping our society going and looking after all of us harder, obviously. It's hit those who are been living in poverty with many health conditions as a result. And then government policies on top of that have made things even more unequal. What is so important coming out of this is that we all really get together throughout all our communities on the ground and really put forward a vision of the kind of society that we need to build out of the, frankly, wreckage of what we're going to be left with. And it's up to all of us. If you look back through history, it's little people like you and me all getting together in a united fashion that has actually brought about really significant and big changes, both in this country and in other countries around the world. So I just finished by really commending you for your work, and well done to each and every one of you in terms of very difficult situations you're working with, and the fantastic way you're thinking about things and approaching it. And Wish you all the best, and thank you for inviting me.
Thank you very much indeed, Susan. And we could quite often say at this point, if we were in a room, there'd be thunderous applause, but you have to believe it that it's there. I do think that Independence Age has been such a pillar of integrity and not alternative truth. I nearly said alternative truth, of truth versus the spinning that has really been the hallmark of this government. And of course, if the government had done the right thing, even if we didn't vote Conservative at the last election, we would have been delighted because there's hundreds of thousands of lives at stake. But they've just done the wrong thing time and time again. And covered up for it, and refused to learn from mistakes. So the hubris involved, the arrogance involved is a killer. I've watched Independence Age. I think you started in May, but you've gone from about 500 or 600 Twitter followers to 121,000 in the last few months, and now you are a real pillar of reality, and more of the media are having to listen to you. And thank you very much. So keep going. You must have some stamina. That's all I can say. We have I wouldn't say maybe I've chaired this very badly, but we've had fantastic speeches, and we've used pretty well all the time. I'm going to run over a little bit if you don't mind. We've still got 71 people with us, so thank you very much. I'm going to pick up some of the comments that have been made in the chat room, but not be able to have discussion, I'm afraid. And we'll see what happens there. There's a call for a zero COVID campaign. Now, there's at least 2 different initiatives from different organizational backgrounds, but there's an initiative today, a Zero COVID Alliance, I think it's called, to bring all the different people together who refuse to give up on the idea of suppressing the virus and having the find, test, trace, isolate with support in place. And Susan and other people's message is that this is going to be with us possibly for years. The vaccination isn't the only answer, it's part of a set of answers. And the campaign will continue to raise the flag that Independence Age have been saying right from the word go, we have to have in public hands with local ownership and partnership between GPs, public health and local authorities, test, trace and isolate with support. So that is going to go live. There'll be a public conference a week on Saturday. I think one of the subsidiary campaigns has one this Saturday as well, but we, Keep Our Anxious Public nationally, will be involved with that, and there'll be information about that coming out soon in the media. So that's the answer to whether we support a zero COVID campaign. There was a comment about the impact of COVID on people who are disabled, and that is a hugely important issue. We weren't able to have a speaker for the disabled community today, and I'm sorry about that. We'll be having more meetings and that will be redressed. But we probably all know that the risk of, for example, an adult with autism and learning disability in a care home dying is many, many times more than the average person. And there's a huge impact. Somebody's asked, Susan, you may know this, but there's a care company called Sage, and they have care homes, and the care workers are very low paid, employed, well, they're unionized now by the Universal, UVW, Universal, I've forgotten the name of it, the new union, Universal Voice of Workers or something like that, and they're on strike at the moment. So somebody was asking us, do we support that, and will we give a shout out for the UVW strike? And yes, we do, and we do support them, not to be confused with government Sage or independent Sage. I wanted to mention that sorry, there's a plethora of new messages and I can't look at them all, I'm afraid. So I'm just going to say that a recording of this meeting will be available soon. We'll get it onto Facebook. I think it'll be on the Save Lewisham Hospital Facebook. So, and we'll also be publishing a set of demands that are relevant to COVID and that partly come out of this meeting. And we'll be publishing that on our website. I just want to say the website, www.saveLewishamHospital.com. And I would also like you to consider, if you're not already in touch with our campaign, getting in touch with us, emailing us, and or getting us through the website. I think the email is savelewisham.hospital at yahoo.co.uk.
No.
What is it?
It's at yahoo.com.
Yahoo.com, sorry. Louise, you have your hand up and I'm going to take you, please, and just unmute yourself.
Oh, yeah, just a quickie. So Aaminah, Lola and myself will liaise with Hera about the issue of the vaccinations for migrant vaccinations, see if we can find a resolution for that. So people should, you know, hopefully we will be able to do that.
Thank you very much, Louise. And there's work going on with Docs Not Cops and MedAct to put a campaign out to make sure that migrant and undocumented know their rights, and that primary care and CCGs know the rights of migrants. A couple more announcements, if that's okay. So first of all, join our campaign. Consider joining nationally. Keep our NHS public, please. It's a growing campaign. It's got 70 branches around the country, of which one is the Save Lewisham campaign. We have a model resolutions one passed in Oxford that the council passed in order to take up the chain demands for test and trace to be put in the hands of local communities, local authorities, primary care and the NHS. And there's also a model resolution for the same issue about vaccination programs, just making sure that they're locally based, but also funded. And the point that I think Aaminah made, that the vaccination program is not being funded, so GPs are losing out and actually not being able to afford to or to find the staff to run. So those resolutions are available if you want to get in touch with us. There's an Islington Keep Our NHS public meeting next Tuesday. You may be interested in it. There's another great member of the Independent Sage, Anthony Costello, speaking, who's a paediatrician and has worked for the WHO in the past. And also John Ashworth is speaking, the Shadow Secretary for the Labour Party. Islington Keep Our NHS public jointly with the local Labour Party. We've got many issues to campaign on, which we've discussed today. And we will be putting those on the website and possibly on Facebook as well. It's now 25 to 9, and I think, are you wanting to speak again, Louise, or just waving your hand?
I just mentioned the HCT privatisation conference.
Yes, go ahead.
Well, I thought maybe you would, because I haven't got the details in front of me, but I thought it might be a good opportunity.
Right.
Sorry, Tony.
HCT is Health Campaigns Together. That's something that Keep Our NHS Public set up in alliance with other organisations 5 years ago, and it's organising a meeting on privatisation and COVID, and that is. Am I going to be able to find it quickly enough to speak to you?
Tony, it's the 25th of February.
25th of February, thank you.
8:30 to 8:30. They sent out an email in the last day or so saying.
Just say the time again.
6:30 to 8:30 on the 25th of February.
Thank you very much.
That was in the latest email HCT sent out in the last couple of days.
Thank you very much. That's my bad for not having that ready to say.
Right.
Don't tell anybody. I'll get told off for that.
No, you won't.
So I think we should finish there. Thank you everybody for your support. Thank you also for your stamina. There's 66 people still watching. And thank you to all the speakers, and a really good array across from Susan Michie and her great academic and professional interest, Duncan Morrison from the NEU, the parents and pupils and students, and the NHS frontline staff, and Hera for migrant staff, Migrant campaign. Thank you very much, and we'll see you soon. We will be having more meetings. This is our first Zoom meeting for some time, but not our last. Bye for now.
We say a big thank you to the O'Sullivan family for putting this on. There's so much work involved. Thank you.
Thank you, Barbara.